I want to start just by giving a overview of the industry. And we've talked about this at previous meetings, but it's a little bit fuzzy when we talk about bioelectronic medicine. How do we define it? What do we include? What do we not include? So these different organizations will have different definitions, but the one that we've been working with is bioelectronic medicine regulation that affects, and this is the definition that the NIH used in the Spark. In the Spark, okay, can you turn your sound off? Thanks. Now, other organizations, including DARPA, have included a more inclusive definition of bioelectronic medicine. We'll talk about that in a minute. But for the purposes of what we include and what we're going to be talking about today, it's going to be largely talking about organ stimulation. So what's included? Organ stim, about $1.4 billion market. If you take a more inclusive definition, pain stim adds about $3 billion. If you include neuroprosthetics, that's another $2 billion. And other forms of neuromodulation brings us to a total of about a $14 billion market. So here, this is a chart that's taken from our market research report, the market for bioelectronic medicine. And the blue represents those core applications, and the orange represents the expanded definition. Let's talk a little bit about, from bioelectronic medicine, if there is a difference. And again, this is a question that's been that's yet to be resolved. As many of you know, we launched a new publication this year at Neurotech Reports called Bioelectrics Business Report. And Bioelectrics Business Report is our monthly newsletter covering the bioelectronic medicine industry. And as editors, it's given us some pause to consider, all right, what do we include in Neurotech Business Report, our existing publication, versus what we include in Bioelectronic Medicine Report. And how we break things down, at least for now, is just to give you an example of the difference. In neurotech, traditional neurotech, the targets are brain, the CNS, and so the brain, the spinal cord, the peripheral nerve system. The indications, mostly pain, but also movement disorders, epilepsy, things like that. Whereas in bioelectronic medicine, the targets are the end organs, the heart, the bowel, the bladder, the lungs, the liver, the cells, etc. The indications, heart failure, inflammation, hypertension, OAB, OSA. But really where we see some of the differences emerging, and why, if indeed bioelectronic medicine is going to become a new industry, and we believe it will be, what makes it different is going to be the personnel. Where are they coming from? What conferences and events do they attend? What professional societies do they, technologies they're comfortable with and familiar with? And it's not just the engineering and the medical folks, it's also the salespeople, and it's also the business executives. Where are they coming from? So we think bioelectronic medicine is in common with the pharmaceutical industry. And so it's kind of occupying some middle ground between med tech and pharma. Yes, neural engineers are definitely involved with bioelectronic medicine. We're going to hear from several of them today, but also cardiologists and internists and urologists, med tech execs, but also biopharma execs. And we're going to be we're going to have a session later this morning on some of those interactions that Jojo Platt is going to moderate. Also a little bit about the revenue model. In traditional neurotech, you sell the device, you get a CPT code for a procedure, and hopefully you get reimbursed for that procedure. And in bioelectronic medicine, you may see things like that as well. But there's also, and hopefully Peter, our keynote speaker, will share some of his experience being a pioneer in this area of charging by the dose. Now, it's not happened to a great extent, but we're gonna, I think, see more examples of this as time goes on. Now, just a little bit about some of the nerve targets that we see in bioelectronic medicine. And this is not an exhaustive list. This is just an example. And primarily, we're talking here about implanted devices, although when you talk about the vagus nerve, there's a large list of vendors of non-invasive vagus nerve stimulation systems. But just from a historical concept, some of the companies who have marketed implanted VNS systems, LivaNova is currently the leader, of course, with their device. There was a company called Biocontrol pursuing the heart failure application. Unfortunately, that company failed because of a clinical trial failure. Some promising companies that are actually with us today, Setpoint Medical, Neuraloop, Synergia, using new technology. I'm not going to steal their thunder. I will let them talk in more detail if they're so inclined about what makes their devices unique. And what are some of the indications? As we mentioned, heart failure, inflammation. Although Synergia, I'm sure, is also looking at epilepsy as an application, even though that's more of a traditional. I'm sorry. In the hypoglossal nerve is another important target for applications like OSA. Currently, we have 3 players: Inspire, Nyxoah, and LivaNova, who's approved in Europe. That's going to be, we think, a pretty expanding market. Sacral nerve stimulation, we have 2 major players right now, Medtronic and Axonics, competing in the implanted SNS market for treating OAB as well as fecal incontinence. New Sparrow, we expect to be in there. But guess what? There's also a bunch of tibial nerve stimulation companies pursuing that indication. And Medtronic is one. Valencia is recently approved. Laborie has been in that market for a while. Blue Wind, and a company called Euro out of Florida. Finally, there's a company called EBT, founded by Keith Carlton. Some of you may recognize that name. They are developing a saphenous nerve stimulation device for treating bowel and bladder disorders.